Well, it's 8:35, and we'd like to welcome back to the microphone Bob Keller, New Reports Myokin Pain Relief Practitioner. And Bob, good morning to you.
Good morning, Wynn. It's always a pleasure to talk with you.
Oh, it's nice to have you here. You sound just like your radio commercial.
Funny about that.
Those are very fascinating stories.
Thank you. Yes, I'm very pleased with the results that we've had.
Now, for folks who haven't been following the bouncing ball, remember that, Mitch Miller?
Oh yes, absolutely.
Tell us in a thumbshell what Myokin treatment is all about.
Well, what we're trying to do with the Myokin treatments is to deal with pretty much any kind of pain in your body, whether it's headaches or shoulder or feet or knees or lower back. And what I'm trying to do with that is to remind your body of its natural pain-free state. I do this through very simple movements of your muscles and very gentle stimulation. And so far, we've had very good luck with it.
Now, yeah, you have a lot of success stories so far.
So far, we've had quite a bit.
Yeah. And now, today, you wanted to talk about lower back pain and hip pain. Is that all connected to the same deal?
Well, it certainly is connected, and you may understand why I'd like to talk about it, because low back pain is second only to the common cold as a reason for people losing time from work. And it's also one of the main reasons why people consult doctors and why they go to hospitals.
Lower back pain?
Right.
I didn't know that. Wow. Now, I've noticed as people age, they tend to be a little bit stiffer in their movements. Is that generally because the lower back may be hurting them a little bit?
Well, it certainly may be. And what you probably also don't know is that probably 90% of Americans are affected by low back pain at one time or another, and of those, half usually have more than one occurrence. And even further, which is interesting, of the people who go for a thorough medical examination, about 85% of those, the doctors can find no reason for the low back pain. So, I mean, my recommendation is, if you've hurt yourself, you've hurt your back, by all means, go to the doc and see if you can find out what's going on. But if there's no obvious reason, the next thing you should do is to try Myokin. I'm right here ready to help you.
We're talking with Bob Keller, New Reports Myokin Pain Relief Practitioner, and you are in the Meriden Body Therapy building. That's at 166 Water Street in Newburyport. No danger of washing away, right?
No, so far all of the flooding has been further up the road.
Okay, well that's a good thing. Now, yeah, tell us a little bit more about the back pain. And maybe I'm listening to the wrong people, but I was always under the impression that as you get older, your spine kind of it gets compressed, and the discs kind of dry out a little bit.
Well, there's no question that there's some wear and tear on the discs, and there certainly is the possibility of some arthritis. In fact, it's fairly common, whether it's in the little facet joints that are around the discs or in other parts as well. And the discs themselves may begin to wear away. They may herniate. All kinds of things can happen there. One thing you may notice when you get up out of bed in the morning, however, is that you do feel a little stiff.
Yeah.
This actually is a property that I will not spell, but it's called thixotropy. And what it means, and this is a property of colloidal materials, which is what is in your body, and when it's not moving, it tends to get thicker. So if you feel as though your body's beginning to solidify, it really is. But the way you take care of this is you get up and you start moving. And heat, like a warm shower, is great for it, which will help the stiffness. But there is always that arthritis, the stenosis, and other problems that really need some kind of treatment.
And that's what Myokin is all about.
Myokin is all about treating those lower back pains. I've had several patients. In fact, the very first patient I worked on with Myokin techniques some time ago had a chronic low back hip pain for years, actually. And we did one very simple treatment, which was on the L1 nerve root. And I talked to her sometime later. She only came for one treatment. And I said, "What happened to your back?" She said, "Well, I didn't notice anything right away, but 3 days later, I suddenly became aware there was no more pain, and there hadn't been any pain for a couple of days. So this is the kind of results we're hoping to achieve. Doesn't always happen that way. I have another current patient who has low back, hip pain, and we're making incremental strides in improving that. So I never know whether it's going to be an immediate cure or if it'll take 3 or 4 treatments, and sometimes as much as 6 or more. And there are those rare people that I can't help at all.
Well, and sometimes after you've helped them through their initial pain, they need to keep coming back.
This is very important. A growing number of my patients are coming back for what I would call a tune-up, partly because if you continue to do the things in your life that brought the pain on in the first place, there's a good chance it's going to come back. And my recommendation is that you come in for treatments frequently enough that we can head off the pain returning. So in the first week, I like to see a person 3 times if we can. And then once we've got the pain under control, they may decide to come back once a week, once every 2 weeks, a month. It depends. We kind of figure that out on the fly, how long they can go between treatments without having the pain return. What we don't want to have happen is to have the pain come back as bad as it was in the beginning, because then we have to start from scratch.
So your treatment, the Myokin treatment, it's a way of getting the muscles to remember the way that they should act.
Absolutely. We're retraining the nervous system, truly. We first work on whatever the nerve root is that's causing the pain, and appears to be causing the pain. And once that's under control, the central nervous system takes over, and it moves muscles, it moves things that it can in order to keep it pain-free.
But if the person who has those muscles and nerves doesn't pay attention, then the thing just slide right back again.
It can come back.
Yes. Neat. Well, you know, every time you come by here, I'm always learning something new. And it's neat. And all I have to do is call your office. It's 978-465-5111. It's a pretty simple number to remember.
And again, we're at Meridian Body Therapies at 166 Water Street here in Newburyport. And you also might want to visit our website, which is myokineast.com, myokineast.com. There you'll find, among other things, many video testimonials from patients who've been helped by Myokin. And soon, I'm hoping we'll get these interviews on there as well.
Oh, no, it hasn't happened yet? Darn it.
Well, some of them are on YouTube, but we haven't got them through the website yet.
Kidding me. We're famous.
Yeah, well, I don't know about that.
Well, Bob, I want to thank you for joining us. So it's the Myokin Pain Relief Center, and it's, well, you're the Northeast Myokin Pain Relief Center.
That's right. That's
neat. How long did it take you to, I know you're always continually learning and stuff like that, but how long did it take you to get the basics down for this treatment?
Well, there were 2 40-hour trainings at the beginning. And one of the questions I asked during that training was, how long will it be before I become productive with this stuff? And the answer was, as soon as you go home. And it turned out to be true. That first patient I worked on who had immediate relief, I worked on as soon as I got back.
Oh, that's great.
So we'll do training another 40 hours this year and probably the year after next as well.
Yeah, 40 hours and then the years of experience that you have.
Absolutely.
Excellent. Well, Bob, I want to thank you for joining us. Bob Keller, Newburyport's Myokin Pain Relief Practitioner. So it's 978-465-5111. The website is myokineast.com. And 166 Water Street. What's the road that comes down?
Well, it's right at the corner of Bromfield and Water Street.
That's it, okay. All right. Terrific. Hey, Bob, thank you so much.
Thank you, Win.
978-465-5111.